Hey, Dr. Josh Wagner here with Patient Mastery, where we show awesome docs how to become the go-to doc with best collections ever, more time off, and loving practice. Now, a question came in from a doc not in the group. When the new patient has tons of new questions, it took me 40 minutes to go through the consult or exam, and normally it takes me 15. How do I handle that? So there's a lot of different possibilities. The first is, if you don't need that new patient, you've got enough. This office isn't for you, and refer them to the colleague down the street you really don't like. Yeah, literally, that's one option. Probably not the one you're gonna do all the time. Two is answer them and realize this person may not be challenging you, they're probably just really nervous, insecure, worried, analytical, all of that. So answer them genuinely. There's a time and a place to educate. It's not in the beginning unless someone is asking you for answers. So answer, educate, but probably to save you time, what's really going on is something we teach in Patient Mastery, which is called FAQs. So you probably know what FAQs are, frequently asked questions. You get them all the time from patients, new patients. One of mine that I remember most was, is it okay to crack my neck? That's a frequently asked question. What is an SBAQ? That's taking a frequently asked question and turning it into a should be asked question. Now, what happens when you do that? When you take an FAQ, turn it around into a should be asked question, one, it increases your leadership and authority because you're like, you know what the right question is and they don't. Two, you're giving them a better answer than what they even were trying to get, and it positions you as you're there for them. So how would you switch, is it okay to crack my neck all the time, from a frequently asked question rather than just answering it to a should be asked question? Well, here's how I did it. Patient asks, is it okay to crack my neck? In between visits, in general, whatever. And I'd say, well, that's actually not the best question. The real question, the should be asked question is, what does it mean when I feel the need to crack my neck? That means there's instability. It doesn't matter whether you crack it yourself or not. It's the need to is an indication you're not stable yet. See what just happened? Gave her an answer, but gave her the better, or him, the better answer. So when someone's asking a lot of questions, and especially if they're coming from a nervous, anxious, worried state, you don't have to just give an answer. You can say, like, you could turn it to a should be asked question, but you can also get underneath. So should be asked questions, or where's that coming from? Underneath. What's causing you to have all these worries? They're in your office for a reason. They've taken that leap of scheduled appointment, driving over, paying the exam fee, and they're there because there's a level of hope, trust, and risk that they're willing to take. Now they're just getting all this stuff off their chest, but asking, hey, did you have a bad experience in the past? Did a family member have a bad experience? Do you trust everything you read on, MD.com or WebMD? Getting underneath will usually asking, like, where's this coming from, will open up what's the example, and most likely it's a one-time example, not a general trend. And you find out what the truth is, and you show them caring and compassion, and you're just there to help them, and you don't need them without saying, I can just refer you out, but having that energy and that tone, that's what has people attracted to you and want more, especially skeptical people, when you're unneedy, rather than trying to push more on them and convince or educate or sell. That repels people. That's why when you're taught sales techniques, you're also taught more overcoming objection techniques, because those things in 2020s turn people off because every service uses them. So instead of sales techniques and trying to close people, try to open people with a patient-centered approach to getting their life back and starting care, and you will notice when you use the PM proven process, the 6-question consult, the 5-step recommendations, that you really don't get objections, so you don't have to overcome objections or learn all of that or feel like a salesperson, and you can wake up in the morning looking forward to going over recommendations and money because it's so easy, it's so natural, and it's inspiring rather than like, we're gonna close someone into a box and get them to pay us money that they weren't expecting to, and all that hoopla that you probably didn't sign up for, neither did I, when you chose to become a chiropractor. So be your best with them, get the underlying reason. If you don't need the new patient or you know they're gonna be a drain and a cancer, just refer them to the person down the street. That's my answer for today. You need more help? Reach out. We've got you.